Hi guys, I'm going to give you a little heads up on what to expect this episode. It is the lactation consultant episode. So the number one question I get is like, how often are you pumping? How do I increase milk supply? All these things, we're going to talk about all of it when we get into this episode. We just filmed it and I'm doing this afterwards. And I want to say my favorite theme throughout was your baby, your boobs, you're the boss. So the number one thing, do what works for you. I share a lot of what works for me in this episode, and Naomi, who is our beloved lactation consultant, shares a lot of what she that's a tongue twister, what she sees works. So I hope you guys enjoy the episode. And now I want to say this episode is sponsored by Miracle Milk Cookies, which is now Miracle Mama. So it's miraclemama.com. I got these gifted to me by my dear friend Katie when I was 2 months postpartum. It is the most delicious cookies that arrive to your door to help increase milk supply. And the way they do it is they've got brewery yeast, they've got oats, and they've got flax in them, all which Naomi tells you in the episode help increase milk supply. They taste delicious and they come right to your door. They're made for you so you don't have to waste time making cookies because you have so much going on. And when you're pumping and you're breastfeeding, you are ravenous for a cookie. So it's the sweet treat of your day and it is so good. I give them to all my new mama friends. So you guys go to miraclemama.com. Get the milk cookies and use code 2parents for 20% off. That's miraclemama.com and use code 2parents for 20% off. They are unbelievable. Now I'm craving one. Welcome back to another episode of Two Parents and a Podcast. Today I am so excited because we are going to do our milk episode. We are joined by Naiomi Catron.
Yes.
Who in my head I've been saying Naomi Catron, but it's Catron.
Yes.
You are the founder of Milk Diva Lactation Services?
Yes, Milk Diva Lactation, Chiropractic, and Infant Nutrition is the full name.
Wow. Okay. And she's in her scrubs, so you know it's legit.
I'm doing the things.
You're a labor and delivery nurse.
I was a labor and delivery nurse.
You are board certified lactation consultant.
Correct.
And the author of Milked.
Yes.
So you're like the milk lady.
I'm the milk lady.
So I think that my first question to you is, what is the most common mistake new moms make when it comes to breastfeeding?
Right. That's actually why I wrote that book, the book Milk, because that's my whole world. As a lactation consultant, one of the hardest things for us to hear is, I wish I would have known that. Because a lot of that they're simple things. There's not a lot of rocket science. It's more just like, it's like a puzzle. Like you just have all these puzzle pieces on the ground and not each piece is meant to fit in is not meant for necessarily your situation. So we have to find the right puzzle piece to fit your situation. So the first thing I want to say is I love how when you're talking about your choices and your feeding and your breastfeeding experience and your birth, you're very clear and you're like, this is my experience. I'm not sure that this is what everyone would work for everyone else or would be appealing to everyone else, but this is what works for me and my family. And that's super important to own your journey.
I feel as though even giving, yes, because it was so individual to me and emotional and personal and just, I don't want to give, the only thing I'll say is like, this is the pump I use and this is the amount of times I do pump. But other than that, I'm like, I don't know that I can give advice, but you can.
Well, every family that I see, I'm like, I tell them, I'm like a Inspector Gadget. That really dates me though.
Yeah, well, we get it.
But that's like I am here on my first visit, evaluating, asking lots of questions, making lots of observations. So then in the back of my mind, I'm pulling out all the tools that I have to make a customized plan for you. And what I tell you on our first visit in this newborn stage in the first 2 weeks is going to be appropriate probably for the next week or two because your baby changes so much in the first 8 weeks. So the advice that is appropriate at day 5, 6, 7 of life is not going to be appropriate at 2 and 3 weeks of life. I saw an episode where you were talking about, like, I used to feed my baby just 3 ounces and she was eating all the time. So I increased, and I was like, exactly, as things progress, your baby, their needs and the plan changes. So to answer your question, the number one mistake that I see, or like question that I see, is parents of newborns don't know if their baby's getting enough.
Yeah.
And so you have two usually schools of thought. It's like, I'm breastfeeding, ride or die until the wheels fall off, period. There's no other option for me.
Okay.
And while I don't know if my baby's eating enough, I'm just going to keep putting him to the breast. And that should be enough because that's what the textbooks say. And then I have this other school of thought of like, the baby cried. Clearly, I'm not making enough. Let's give a bottle.
Right.
And so I don't know that it has to be that stark. There's a nice blend in the middle, but a lot of this is very dependent on how old your baby was born. So if they were born at 37 weeks versus 40 weeks, that's a whole 3 weeks of totally different feeding behavior that you would get. And I think it's so nuanced that reading a black and white textbook on this is how it should go in a vanilla world, I would say more than 40% of women do not have what we call vanilla deliveries. Vanilla is I'm, less than 35 years old. I had a baby at 40 weeks old. There was, I pushed for less than 3 hours. There was no Pitocin, no epidural, no drugs. My baby does not have jaundice. We have the same blood type, and they're awake and able to feed, and no tongue tie.
Wow.
I would think that number would be 5%, not 40%. I thought it'd be so low.
Yeah, there's a lot. It depends, like what part of the country you're in. Mm-hmm. And I'm talking just about America, but there's not a lot of vanilla deliveries. Like a vanilla delivery was in the 1960s. People are popping out babies at 21 years old, no medication, they're term babies or not having C-sections. Like that's vanilla all day long. It's just not generally what I'm seeing most people to be. We're older having babies. We have complications. We have hypertension. We have C-sections. We have epidurals. And there's nothing is wrong with any of that. Mm-hmm. It just means that the advice that will be given cannot be vanilla advice. So that's why I wrote a book for all the things that are not vanilla.
I like that because I would say most of the time what we see today is not vanilla. Mm-hmm. Okay, so I think my question right when you have the baby is around milk supply. Mm-hmm. And I think a lot of people worry about, am I making enough? Will I start to make enough? Or can I even produce milk? Mm-hmm. And what is the school of thought there?
There are some people who have risk factors for having low milk supply. And if you do, you know that before you have your baby. So you should have a lactation consultant get with you before you have your baby.
How do you know you have low milk supply before the baby?
If you have the risk factors. I'm not saying you do. I'm just saying if you have these risk factors, for example, infertility or IVF, if you have diabetes, if you know you're going to have a C-section, if you're older than 35 years old, if you had a breast augmentation, specifically a reduction, mm-hmm. that puts you at a high risk for low milk supply. So you want to get with a lactation consultant before you have your baby, and they'll help you do some things and tips and tricks to maximize milk production when your baby's born. But if you don't have any of those things in your story, then the best way to maximize milk production is frequent and effective milk removals. And so what I tell my patients is I don't care who or what removes the milk, but it needs to get done effectively and frequently. And so if it's not your baby, then let it be your hands or let it be your pump. And so the challenge with that advice is, this is Texas, so bigger is better and more is better. Mm-hmm. We want to be careful that we don't then start causing ourselves to do oversupply and causing us to have damage to the breast. Because some people will get a pump on, and it doesn't matter if they even know the parts are the right size or not, and they'll crank that puppy up. I had a patient yesterday who had her Spectra pump up to a 12, and I was like, oh, your nipples are like tires. We have mileage on them, and that is definitely going to minimize the amount of mileage you get from your breast and your nipples. So let's and she was starting to get herself an oversupply. So generally speaking, when you first have your baby, I like to teach this prenatally, but people should learn how to hand express so they can gently learn how to massage colostrum, which is just drops out of the breast, and you can feed it in a plastic spoon to your baby. If you try to use a pump to get those little drops of colostrum out, all those little drops just stay in the pump flanges. Mm-hmm. Really, if it's 10 drops, by the time it gets through all the pieces into the bottom of the bottle, you're not going to have much to give to your baby. But if you can use your hand and use a little spoon and just gently massage, get it right in the spoon, and then pop it right in your baby's mouth, you just keep the party moving.
Finding great candidates to hire can be like trying to find a needle in a haystack. You get too many resumes and not enough candidates with the right skills or expertise. But not with ZipRecruiter. ZipRecruiter finds amazing candidates for you, and they do it fast. And right now, you can try it for free at ZipRecruiter.com/Alex. ZipRecruiter's smart technology identifies top talent for your roles, and they do it quickly. Immediately after posting your job, ZipRecruiter's powerful matching technology starts showing you qualified people for the job. You can use ZipRecruiter's pre-written invite to apply messages to personally reach out to your favorite candidates and encourage them to apply sooner. Ditch the other hiring sites and let ZipRecruiter find what you're looking for, the needle in the haystack. 4 out of 5 employers who post on ZipRecruiter get a quality candidate within the first day. Try it for free at this exclusive web address, ZipRecruiter.com/Alex. Again, that's ZipRecruiter.com/Alex. ZipRecruiter, the smartest way to hire. I remember being in the hospital and we were just learning about this whole adventure of breastfeeding. And the nurse came in and I put her on my boob for what was, I think, a minute. And she was like, she's probably full. And I was like, wow, like that was all she needed. And it was just at that point, like little drops. And I don't even remember how often I was breastfeeding her, but she just said she just needs to get a little bit of drops of these colostrum. And like that's enough right now.
Textbook answer is 5 to 7 milliliters, 8 to 10 times a day. So if you do 5 times 8, that's, 40 milliliters, which is an ounce and a third for a whole 24-hour period for the first day of life.
Yeah, I thought they,
wow.
It's like a little marble.
Saying, like the size of her stomach is like a peanut or something.
They do like little marble, and then they like go into, they have different, they have like a little tag and they have different shapes. I have a couple videos on my website on it, but it's really small. What people may give a little pushback to you on is, if their stomach is only the size of a little peanut, then why is it that she can down a whole 2-ounce bottle? Because that's what I'll get. And so that's like one of my insider tips, because I like all the insider stuff. I like all the stuff that you can't find on Google or whatever. And what you should know is your baby has a suck reflex. They're born with this suck reflex, and it's right behind, like if she had teeth, it would be like the palate right behind those front teeth. So when a bottle nipple touches that little suck reflex, they'll just keep on sucking. It don't matter if they're full already. They're just going, and then they just like keep inflating like a little, full little whatever. And then, you turn them over and they might spit up half of that.
Right.
So they can eat more than that 5 to 7 milliliters that you may offer them, but it's not necessarily what they need metabolically. The other little disclaimer is if you have like a 9-pound baby, all this little 5 milliliter business goes out the window, and they do need more milk.
Okay.
But this is more for an average size baby, 7.5 pounds or less. 5 to 7 milliliters, 8 to 10 times a day in that first day is completely sufficient. And learning how to do it with your hands, removing it with your hands, can be really helpful for a baby who's so sleepy and tired from a long birth, a long labor.
I mean, that makes a lot of sense that because I would think too, is she hungry? Because every time we give her the bottle or we give her the boob, like she is drinking it.
Yeah.
But that's because she has that suck reflex up there. Makes a lot of sense.
And babies who are hungry just don't settle down. Like you can't just put them down and they like chill out. They're just frantic, and they're just look stressed and unsettled, and they're always looking to latch to something. And that's just a baby who's still hungry. So you always have to follow your baby's lead, regardless what the textbook says.
Right. So what do you think about the difference? I want to touch on like the difference between breast milk and formula and your thoughts on it, because there's those taboo sayings, right?
Oh, why are you trying to give me hate mail?
No. It's so just so you know, like
you do a little bit of formula, right?
Yeah. I'm combo feeding.
Yeah.
I'm combo feeding. I'm a big buy heart with the packets. When they made those travel packets, like changed my life, because we travel a lot with her.
So super convenient. Yeah.
Super convenient. But I think what a lot of messages I get is people feel guilty giving their baby formula, whereas it's equally so mentally taxing and daunting. Like I work from home, right? So I'm able to breastfeed and pump. And I don't think that's the reality for a lot of women, right? And I think that,
that's a very good point. You're saying you're setting it up properly.
Yeah, I've got like best case scenario of
Yes.
being able to do this, and like I don't even think that that's fair. So I really want to advocate for like both sides here. But then you get online and you see breast is best, or you see a fed baby is a happy baby or a healthy baby.
Fed is best, breast is best.
Yeah, there's all these like taboo sayings, and I think it's like difficult to navigate. So what do you think difference wise between formula versus breast milk?
So I think there should be another saying that's like, I don't know how to make it rhyme or whatever, but something that puts into, to consider the mom's mental health.
Totally.
Because it's like, breast is best, but not if the mom wants to like she hates her life and like misses the whole first year and all the joy of having a baby.
No question.
So I was you're just enougher, you called yourself, I was a low milk supply mom. And yes, while we're talking to our, our audiences in North America, as, we're an industrialized country, the advice that I would give and how I would answer that question if I was in a different country would be very different. So I work with another organization in Africa, and in that case, breast is best. That is the difference between life and death, because they have a very, very high infant mortality rate, because water is not a safe source to mix formula with or clean bottle parts. So in that case, they have a very high, babies die all the time, and it's from dysentery, from water they use to wash bottles and nipples from. We're in America though, and we're not in that situation. And so we need to consider what keeps the mom or the birthing parent able to be present with their baby. Totally. And if they're working, like in my family, I'm the first one to attempt breastfeeding. It was a hot mess. My son is 20 years old now, one of them. And we didn't have Google or like Instagram or any YouTube to get help. So you had to figure it out. And since I didn't have family who could help me and kind of guide me, I was just way on my own. It was very lonely and isolating, and my mental health did suffer from that. And I did use formula, and it was the only thing that helped me like being a mom again.
Totally.
And so in that case, that's when it is appropriate. However, we need to help support moms. We can't just put them back to work at 6 weeks and then say breast is best. That's super that's gaslighting you. That's setting up for very unrealistic expectations. That's also trying to say, Mom, you can work, you can have a baby, you can have a career and a fantastic life too. And those are just not realistic things. There's not enough hours in the day. And so I would just say both of those statements, breast is best and fed is best, are just asking for problems. The original Fed is Best was created by a NICU nurse and an ER doctor who kept seeing babies come in from dehydration and malnutrition. And they were like, please don't let your baby get dehydrated, just feed your baby.
Right.
And that's really important. And then breast is best is like, because in real life, if you were to look at breast milk under a microscope and formula, do you guys, I don't know if they still make this, do you have that powdered juice called Tang? Do you remember? Do you know what
I
that
remember.
is? Okay.
Yeah.
Tang is like an orange drink, and so it's like Kool-Aid, but like, so if that's like comparing fresh squeezed orange juice to Tang, and that's not even a very good comparison because orange juice doesn't have a lot of living antibodies in it. But breast milk changes as your baby grows and based on what's happening with their health. So if their baby, if they have a virus, or if you have a virus, like your breast milk composition will change. The fat also changes from nighttime to daytime. So it's a living organism that's always changing. And the calorie count is changing. Formula is the same all day, every day, no matter what time of day. It has 19 kilocalories per ounce, and it has a lesser volume of human milk components to it. It's getting better, but nutrition content for all formulas in America, different than Europe, are all the same.
Okay.
And they have a couple of little fancy features that each different brand may have. Like maybe one might be organic, one might be grass-fed, one might have 4 HMOs, which stands for human milk oligosaccharides, and one might have 2. Breast milk has hundreds of human milk oligosaccharides. So they're not exactly the same, but it's not like you're feeding your baby poison either. It's nutritious. Your baby will grow. They will thrive. The most important thing is, how is the family unit doing? And if we force someone and guilt them into doing something that steals the joy, then you just have a depressed, unhappy wife and mom for the first 6 months or year, and your baby grows up with that negative energy, and we have to consider that also. So that's my 2 cents on it.
I think that it's really important that you, who people look to as a professional, what is the word? Not an advocate.
Expert.
And thank you. I think it's important that somebody that's a lactation expert says that, because that says, a fed baby is a happy baby, and we need mom's mental health to be in a good space, because I saw how it can be so mentally taxing on you, and your hormones are up and down, right? And then you read all this stuff about formula, and it's so confusing to navigate the space, right? And so I'm so happy that was your answer.
And we teach people how to prepare formula properly, how to find the right formula for their baby based on their age. Not all lactation consultants do that. And that's actually why I wanted to become a lactation consultant, because in my mind, I was thinking like lactation consultants are older. They don't color their hair. They don't wear mascara.
Right.
They are like ride or die breastfeed, no pacifier, no bottle, no combo business. And I was like, I want to be like less intense. Like I'm like, let's just do what works for you and your family. I'm not here to put my ideals on you, and that goes to formula too. So if we need to find a formula that works for your baby, I'm gonna help you do that too.
Yeah, maybe it's happy mom, happy baby.
Okay, yes.
Maybe that's our new saying.
That's what we should do.
Magic Spoon makes high protein, zero sugar cereal and treats reinvented from your childhood. Oh, the nostalgia. There is nothing better than a bowl of cereal, except a bowl of cereal that fuels your body. Every serving of Magic Spoon high protein cereal has 13 grams of protein, 0 grams of sugar, and 4 grams of net carbs. They come in nostalgic flavors like fruity, cocoa, and frosted. And there's Magic Spoon's high protein treats, and they are crispy, crunchy, airy, and an easy way to get 12 grams of protein on the go. They come in mouth-watering flavors like marshmallow, chocolate peanut butter, and dark chocolate. Both are great on the go, pre or post workout, or as a midnight snack, which I think is the best time and place to eat cereal. So get $5 off your next order at magicspoon.com/2parents, or look for Magic Spoon on Amazon or in your nearest grocery store. That's magicspoon.com/2parents for $5 off. So, but is it true though that even a little bit of breast milk is super beneficial for the baby?
That is true, and I'll maybe edit that statement to say even a little bit of breast milk in the first few days of life is very important. There's a really nerdy, I don't want to get too nerdy, but when your baby is first born, their intestinal lining has something called gap junctions in there. If they are puzzle pieces, they're not fit real tight. They're really nice and loose. And so what we want are the components of breast milk that have the antiviral, antimicrobial properties, and all the living parts of the breast milk and antibodies to come into the intestine and get into the bloodstream. And then, all of that replicates pretty quickly. And so that gap junction, I don't remember exactly, but it closes in the first few days of life. So we can get drops and drops of milk in your baby in those first few days of life. That's when you get your biggest punch, your biggest bang for your buck. Now, I do like having people, if you're going to formula feed, and if the person is willing to even give a little bit of breast milk mixed with the formula, it does help with digestion, or it can help with digestion.
Okay. And one other thing that you sort of touched on is, do you think a pacifier is good or bad?
Ooh, I have a whole 2-part podcast episode on this, because not all pacifiers are created equal. I think in the first few weeks of life, so what you usually hear is don't give your baby a pacifier until breastfeeding is well established. And so, what does well established look like? That's a subjective term. But what you should understand is we don't want to give a baby a pacifier at first. I usually tell my parents in the hospital, this is what I teach in my prenatal class, if your baby's going to have any painful procedure, which at 36 hours of life, they have a blood test. And sometimes they need blood sugar draws. Give that baby a pacifier. That hurts. And sucking soothes them. That's not going to interfere with breastfeeding. So there's that caveat. Painful procedures, either latch your baby or give them a passy, totally fine. But what we don't want is your brand new baby to nurse for 1 minute, like you said, and then fall asleep, and then you put them down, and 30 minutes later they wake up, and then you say, there's no way you're still hungry. I just fed you 30 minutes. Here's a passy. Because that is the incorrect use of using a passy, because you missed a feeding cue. That baby was actually really hungry. He just didn't get a full feed 30 minutes ago, so she wants to come in for snack time. And they do that a lot in the first week of life. But if you don't know if this is your first baby, you're thinking, well, you're supposed to eat once every 3 hours. It's been 30 minutes. Clearly, it can't be hunger, so I'm going to give you a passy. And so that's the incorrect way. The correct way would be, hey, it's been 30 minutes. Let's put you back to the breast. Let's see if I can latch. Let's see if I hear some swallows. And then once you look nice and comfortable and milk drunk and relaxed, then I'll give you a passy. And then we use a passy for soothing and removing. So they suck on the passy 2, 3, 4, 5 minutes. And then they fall asleep. Passy falls out. Baby stays asleep happily ever after. However, if they keep sucking on the passy like they're trying to suck the color off the pacifier and they're just going to town on it and it's been more than 5 minutes, that baby is still hungry.
Okay, so it's so you don't, because I don't think anybody ever said to us don't use the pacifier.
No, I don't think we really had any passy guidance. And I'm trying to think how old she was when we first gave her the passy, and I can't even recall.
I don't know, and I don't
think she had one in the hospital though.
Sometimes if you have a lot of prenatal input from other people and professions, there can be hard and fast rules like don't do this and always do this, and anytime someone gives advice that starts with always and never, I'm like, oh, well, we should maybe think about that a little more in depth, because having another human, you're in control of, the rules can't be so rigid.
So I think that number one, we had less advice. I think was sort of the, like, I don't think we had so many specialists around us guiding us that we were having always and never thrown at us. I think it was just you and I missed, like, we didn't know how to change a diaper.
Good. That's me too. Yeah.
Yeah. I mean, it was we didn't know about the no water rule. Like, that one was new to us in the hospital. But what I love that you just said is when advice starts with always and never, we should think about it a little further, because these babies, I don't want to call them abstract, but it is what we see is it is so not a one size fits all.
It's very nuanced.
It is so nuanced, and there's a lot of instinct, I think, that comes in. And it's just, I think always and never starts to get so rigid. You're right.
I tell my patients, so the first 2 weeks is a hot mess. Like, if it's your first baby, because you don't know them that well yet, and you don't really know, are you eating enough? Why are you always asleep? What does that cry mean? All the things. However, once you find your mojo, because I usually say, hey, work with a lactation consultant. We're going to stick together for the first 8 weeks. By 8 to 12 weeks, we should have figured out all the bugs, worked this puppy out, and you should be on cruise control by then. And then I say, this is your baby. These are your boobs, and you are the boss. Mm-hmm. So you tweak all the things I tell you to fit, because you're smarter than I am. You know your baby better than I do. I'm only here for an hour. You're with your baby the other 23 hours. So I'm going to tell you why I'm recommending certain things. But you have a brain, as your baby, your boobs, so you are the boss. Mm-hmm. And that's how I think people should take advice, especially advice that starts with always and never.
The 3 Bs.
Yep, the 3 Bs.
Yeah, your baby, your boobs, and your body.
Oh, and you're the boss. Yeah.
You're the boss. It's really good. What about, another question that I'm thinking about that I get all the time is if somebody chooses to attempt to breastfeed or pump, okay, mm-hmm. and maybe they're combo feeding, whatever it is, but they have a low milk supply. Mm-hmm. Is there a way to increase milk supply?
Yes. Frequent and effective milk removal is always going to be the best way to increase milk supply. There are some people who have some lab hormonal issues, like if someone has PCOS or some infertility issues, their body may not want to make a lot of prolactin, and it's really challenging for us to make that happen on its own. In Canada, you can get a medication to help increase milk supply, but we do not get it. We cannot get it here in the States. That's another story for another whole time.
Does it work? And is it safe?
It can really work, and it is very safe. So to answer your question, though, if a person is struggling with low milk supply, the first question we want to discern is it true low milk supply, or is it perceived low milk supply? And the reason I say that is because very often babies will want to cluster feed in the afternoon. So around 4 p.m. till about 8 p.m., you have a drop in prolactin. And so you don't make as much milk. If you pump during that time compared to your 8 a.m. pump, you're going to be like, 5 p.m. pump, not that much milk. 8 a.m. pump, 7 a.m. pump, tons of milk, right? So your baby also knows that. So they might want to nurse very frequently during dinner time. And then you're like, what's going on? I have low milk supply. That is perceived low milk supply. That is not true low milk supply. Because we just want to know how much milk do you make in a 24-hour period. And your audience might want to know that babies generally eat between 25 and 30 ounces of breast milk per 24 hours after 2 or 3 weeks of life. That's going to stay the same. It's not going to go 30 to 40 to 50 ounces of breast milk.
So wait, at 10 months, how much is that? Should she?
Well, she's combo feeding and she's getting solids, so it's totally different.
Okay.
So it's hard for me to answer because depending how many solids you're giving her and the calorie density of them, she may not need a lot of milk. But the goal is by the time you hit 12 months, for them to be getting most of their nutrition from solid food, and the milk that they're going to drink will be for hydration and thirst, not for nutrients like it is when they're breastfeeding and they're little.
So can I ask you this? We're starting to, our pediatrician at the 9-month checkup said to start segueing to solids. And so we've been doing that. But maybe it's something that we should really start doing is actually sitting and eating the meals with her and then giving her breast milk for hydration.
It depends on how much food she's eating and how willing she is to eat it, but we're always going to feed the baby responsively. So we don't want them to be frustrated at the dinner table. So if it's mealtime and she's used to getting a big old bottle of milk and then you sit her in front of a drumstick, she might be like, how the hell am I supposed to get all this in my body? I'm hungry right now. I need milk right now because I don't have patience for all this. And so it's fine to then give her a little milk feed first, not maybe a full feed, and then she'll have the patience and the interest and the curiosity to start playing with the food. Because at first, starting solids is like art class. They get food everywhere except inside their body.
Yeah,
and so it takes a little like finessing for them to learn the fine motor skills to get it in their mouth. And that's why we do infant nutrition, because I have a whole course teaching parents like, do you want to do purees or do you want to do baby-led weaning? And then what kind of foods do they need and how much? And if you do that, how much milk do they need? Because it is very nuanced once again. But originally, you know, I think your original question, I was talking about like seeing if you actually have a low milk supply.
Yes, I'll go back to
and
you.
then
Sorry,
like if the patient does have a low milk supply, then frequent and effective removal. So I would say, let's figure out why you have a low milk supply. Is your baby not removing the milk effectively? And why not? Are they too sleepy? Is there a metabolism problem, which is not very likely? Is there a tongue tie going on? So we'll figure out the baby part. And then the mom part, hey, while we're figuring out baby part, let's get you in a really good pump. Because I had a mom who was using a pump that is a terrible pump, I'm not going to say the name, and was wondering why she kept getting clogged ducts. We changed the pump right away, clogged duct problem gone, and milk supply went up. So using a proper pump, using a proper flange fit, and I would say once you have those things in place, pumping for 8 times a day, spread out throughout the day. So you will need to wake up at least one time and pump overnight because you have the most milk from about 2 a.m. till about 7 a.m., which is kind of lame, but I'm sorry, that's what happens.
Okay.
And then we'll do that 8 times a day for about a week or two. We should see a milk supply increase within a week's time. And then hopefully we would have figured out what's going on with baby and we marry you guys back together.
So I know everyone's going to ask, what pump do you recommend? I use the Spectra. I love it.
Love it.
Is that on the approved list?
I like the Spectra. There's a lot of good pumps out there.
Just a couple that you like.
I like Spectra. I like the Motif. I like Naomi makes a pump called Unimom. Love that pump.
Okay.
You just have to like sometimes work a little bit to get your insurance to cover it. Those are like my top 3. And some people ask like Spectra 1, Spectra 2. I don't care. All the Spectras are great. I can't speak to any of they had the small Spectra.
Yeah.
I don't have a lot of experience with that one.
So I had a friend who had it, who said she didn't think it worked as well as the big, I call it the kettlebell.
Yeah, yes,
I have
exactly
the blue,
what it looks like.
Yeah, I have the blue kettlebell. I love it. Like that's
Yep.
the one I always recommend. But I did have a friend get the smaller one. She didn't think it worked as well. Take it or leave it. I don't know.
Yeah.
I didn't
And
try
it has a weird like gnarly setting. Like it's like it goes super, super fast and then the suction speed is super high. Some of those pumps are a little aggressive. Like I feel like you can get assaulted by your pump. You have to be careful.
Well, we always laugh. We can hear the pump noise. Julie and I were talking. We can hear it in our sleep. Just
Yep.
And it's like never ending. Shopping and planning for groceries really can be simple and stress-free. Imagine having your weekly cart filled for you with personalized picks, then shipped right to your door. Taking all that work off your plate is why I love Hungry Root. Hungry Root takes the stress out of the grocery shopping, and it's even better than grocery shopping because you get your personalized items. Whether you're gluten-free, dairy-free, high protein, focused on gut health, or whatever else, Hungry Root helps you eat well. After a quick quiz, their Smart Cart technology recommends groceries and supplements tailored to your needs, like having a personal shopper that learns what works for you. Hungry Roots holds all of its food to a high standard, screening out over 200 additives like high fructose corn syrup, preservatives, and artificial sweeteners, you guys. Harrison and I are absolutely obsessed with Hungry Root, especially being new parents. It makes grocery shopping so much easier and effective. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/2parents and use code 2parents. That's hungryroot.com/2parents, code 2parents to get 40% off your first box and a free item of your choice for life. hungryroot.com/2parents, code 2parents. Okay, so now I got to talk to you about this nighttime pumping.
Okay.
Because I was doing the nighttime pump, and then I remember I dropped the nighttime pump. I dropped it at the end of January.
No.
In Hawaii.
In Hawaii, December.
End of December.
Well, because you told her, girl, you need to get your mind right. You need to sleep at night. And that's important.
It was the best thing that happened to me.
Yeah, well, it kind of goes back to your point on like what, you know, as a parent or mother, as a mother is choosing the best path for her. like you could see Alex reaching her breaking point, or a breaking point. And I think two big changes that you made that I think really helped your mental health. The first was cutting the night feed. And then the second was the switch to combo feeding.
Totally. Totally.
That's why you got to own your journey.
Yeah.
Yes. And that was just what worked for me. And it was cutting the night feed, the night pump. I was pumping.
Did you pump every 3 hours? Is that what it was?
At the time, I would pump, yes, every 3 hours. And then I would do once in the middle of the night. And like, I was exhausted.
It's so hard, yeah.
I can't believe how tolling it is.
It's very hard.
It's unbelievable.
But let me tell you this. This is a flip side.
Okay.
Is that you do have these patients or moms who are like ride or die. And they're like, nope. Remember I told you I have two kinds of parents? And so you have those that, believe it or not, I have had patients fire me to be like, no, you can't be a lactation consultant because you want me to like not breastfeed as much. And I'm like, you can't pump, breastfeed, bottle feed. You cannot spend an hour feeding your baby and do that every 2.5 hours for 2 months. Like that's not good for anyone in this. You're almost breeding OCD behaviors.
Yes.
And so if I'm going to get on the OCD-ish bandwagon, I'm not doing you a service for your long-term mental health or your marriage, because y'all got to stay married after this baby, right?
No question.
So that's why I tell my patients, I just saw a patient today whose baby is 1 week and 5 days old. And I said, hey, let's make a plan for each of you to get 4 hours of uninterrupted sleep. And I explained to her what that looks like. And I'm like, you go sleep in the guest room from this time to this time. And then you guys tag out and you go sleep in the guest room. And then in the morning, we have less likelihood that we're going to make rash emotional decisions. And we have a higher likelihood that you will still like each other in a week from now.
Which is so important.
Because, girl, my kids are big, and you still, at the end of the day, they don't even realize the sacrifice you did for them. But your man is still there, and you still got to like him.
Totally.
18, 20 years later.
And you want it to be an enjoyable time because it's such a sweet and precious time. But when he would sleep through the night, which we did, we would say, okay, because at first I thought, no, I want him to get up with me in the middle. Like if I'm up, then I want him up. Then I said, no, you got to sleep because whenever in those first, in that first month, right? I've been up so much in the middle of the night. When I wake up and I'm just looking at you like this, he can function, which was so important for our relationship. But anyways, what I want to ask you is dropping. A lot of people will ask me, how do I drop the nighttime feed or the nighttime pump? And do you think that's a good idea to drop it? And I know that your answer is going to be like, what works for you? But let me ask it a different way.
Okay.
What I found was in the morning, I still pumped as much milk in the morning. So dropping the nighttime feed and the nighttime pump was just a no-brainer for me. Like my boobs would fill up, but I would just get up, I'd empty them, and I'd have 8 ounces.
Good. I love that. My answer to that question is I don't think anyone should be dropping the middle of the night feed before 8 weeks of life, maybe even 12 weeks of life.
Okay.
So a lot of our advice, like the advice I give before 2 weeks of life is very different than what it looks like after 8 weeks of life, because there's a whole slew of physiological things that are happening in your body. And between 8 and 12 weeks, we stabilize a little more. So generally speaking, I advise people not to do hands-free pumps or dropping middle of the night feed till after 3 months.
Okay.
And so depending how much milk you make in a 24-hour period, some people who are directly breastfeeding have no idea because they can't measure their baby, right? But if their baby starts sleeping longer at night, then you should sleep longer at night. You don't have to wake up and necessarily pump. However, you could wake up feeling super lumpy, hard, engorged, and then people can freak out and think they have mastitis when they don't. And that's when they really do need to have a lactation consultant because they can help them know what to do to manage those symptoms so that it doesn't turn into mastitis. So some people who are ready, let's say your baby's 3.5 months old and you're like, I want to drop this middle of the night feed. And if you are at risk for getting mastitis, like if you've already had mastitis or you're always getting engorged, then I would say instead of dropping it completely, if you pump for 15 minutes, how about we drop it down to 10 minutes for a couple days? And then a couple days later, we'll drop it down to 5 minutes, and then we drop it completely. As long as your breasts are feeling fine, you're not getting mastitis, and you're not like your boobs aren't up to your chin hard, and you're really uncomfortable. If all of that starts happening, then you need professional help so we can help manage those symptoms.
So if someone's listening to this and they haven't had their baby yet, but they're planning on trying to breastfeed or to pump, in layman's terms, kind of what you're saying. You pump more, you breastfeed more, you produce more.
Correct.
You need to scale. Your boobs start to get so big because you're producing so much. You scale it back. You go from 15 minutes to 10 minutes, and I remember up until the 3-month mark, I would pump more sometimes to increase it. Then I would pump less because I increased it so much, and then. But at 3 months, it starts to level out. Is that true?
Correct. Generally speaking, it's not so labile. Those first 2 or 3 months, it's like, sometimes you wonder, am I ever going to fit in my clothes again? Because your boobs are hoop. Am I ever going to be able to sleep on my tummy again? Like, what's all happening here? And then what happens is at 8 or 9 weeks, 10 weeks, then everything goes back to normal and people freak out and they think their milk supply is gone because they're not walking around with just these jugs of milk all the time. And I try when I work with my patients in the beginning, I tell them that that's going to happen. And if you want to be for sure, let's do another weighted feed. Let's do a consultation, make sure your baby's gaining well. And that's how you know you're making enough milk. But yes, by 8 to 12 weeks, things go back to mostly normal. As long as we haven't accidentally been giving ourselves an oversupply by nursing your baby and pumping all the time. Because then you start making milk for twins.
Oh, wait, let me just ask you this really quick.
Yes.
What is the difference between breastfeeding and pumping?
What do you mean, the difference?
Well, like, I know, like, in terms of what the baby gets, milk-wise, like, why do some people, is it the bond that they exclusively breastfeed? There's not a difference in the milk.
Benefits of...
Direct breastfeeding compared to pumping.
Yeah.
Listen, at the end of the day, human milk is where the money's at. Like, human milk getting into your baby's body is where the benefit lies. Human milk from a mom who likes her life is also really beneficial. People generally, there'll be 2 schools of camp. Well, one will be like, I direct breastfeed my baby because it's easier for me.
Totally.
Like, let's pretend you have 2 other kids running around and taking out pump and washing pieces and taking it and schlepping it with you and then like storing milk and making sure it doesn't go bad in your purse while you're out at the park or the movies with the kids. That's a pain in the ass sometimes. But so that's why they want to latch their baby directly. Or being able to roll over in bed and just put their baby on and not have to sit up and be fully alert to bottle feed and then pump. That's another reason. And then those other people are like pumping. I like to know exactly what my baby's getting. I want to be measured. Like, I don't want there to be guesswork. And I'm at work, and I can't bring my baby to work with me to nurse. So this is what I do. There have been some studies that say that direct breastfeeding has some, microbial level benefits. But I'm going to tell you, as a nurse, because not all lactation consultants need to be registered nurses. However, I don't know that I have seen enough high quality studies for me to even think twice about that being part of my decision-making process.
Okay. So, because a lot of people will ask me, why do you pump versus breastfeed? And I never, the way I always thought about it from, a 10,000 foot view and not having any idea was just breast milk was breast milk was breast milk. Sometimes pumping was easier. Sometimes putting her on the boob was easier. But if I put her on the boob, I could never really tell if she was full. And then I always felt like about an hour later, she wanted more milk. So I just was like, I'll just do like either or, but I never thought a thing of it.
It's very common.
Okay.
That was a conversation it felt like we had a lot, was when at the beginning when like she was on the boob, it was like, wait, do you think she's full? Do you not think she's full?
She would fall asleep. Like, I was just like, and then I would be feeding her for an hour because I would breastfeed her and then I would pump. And I was like, this is not like this. It's too long. It's taken up my whole day. Yeah. So I would move to pumping because I knew it was 20 minutes and I knew how much milk I made and then how much she got. And that was easier for me. But
if you were to have another baby though, and you'd be like, this is a lot of work right now. Mm-hmm. So first thing you should know is that anyone who has a pregnancy past 20 weeks of gestation, you make more milk making, tissue. Mm-hmm. And so let's pretend you're just enougher right now. Don't expect your second baby for you to be a just enougher because you're going to make more milk, period.
Oh.
So you should know that. And
what about foods that can help with milk supply if it is a challenge, whether it be the first baby or there's some, second?
Once again, even before foods, frequent and effective milk removals is the number one way to increase milk supply. And once you've done that, adding things in, like people do, brewer's yeast is really helpful, oatmeal, flax, things like that. And then there are some herbs. There's a really cool company in Austin. I'm going to be on their IG Live. It's a big brand, Legendary Milk. Have you used any of their products before? I don't know if you've heard of them. So. But I mean, I love them, and they have these supplements that have cute names like Pumping Princess and Liquid Gold. And some of the herbs that are in their supplements can help improve milk production. Every person is different. And so we incorporate that if we're struggling with milk supply. And I say, hey, take these for 2 weeks. If you see an increase, then you know it works. If you don't see an increase, please don't keep taking something that doesn't work. But yeah, foods would be oatmeal, flax, brewer's yeast, and then there would be some herbs that can be helpful. But just whenever you're taking herbs, I just wouldn't go to like some random place and order herbs because you don't really know what's in them. So I like a trusted brand that you know is safe. And that's why I'm kind of particular about where I send my patients to get herbs.
You guys, speaking of brewer's yeast, oats, and flaxseed, the best way to get it is through Miracle Mama, which is the maker of the Miracle Milk Cookies, which I have been eating since my friend Katie gifted them to me when I was 2 months postpartum and I was breastfeeding and I was trying to increase my milk supply. So you guys, it is the tastiest way to get all the goods that will increase your milk supply. So you guys go to miraclemama.com, click on the Miracle Milk Cookies, ship them to your house. They come in a bright yellow box. It's like a sunshine being delivered to your doorstep. And then you get to eat the most delicious treats, which when you're pumping and when you're breastfeeding, you are ravenous for. And so go get them and use the code 2parents for 20% off. That's code 2parents for 20% off at miraclemama.com. Enjoy. I'll notice too, if I don't eat protein or if I'm not hydrated. Then it's truly, I will make 2 ounces less. But if I've eaten, if I'm up on my hydration, if I drink my protein shake in the morning, I like try to just get so much chicken and turkey and things like that. Is that mental or is that actually affecting it?
Hydration and stress are really important. However, the hydration part people take to another whole level, and then they start like drinking gallons and buckets of water. And so the nursing hat on me again once will say, if your urine is pale yellow, you're hydrated enough.
Okay.
So, and of course, if you took a B12 vitamin, your pee is going to look bright greenish yellow. So I mean, like without vitamins, your urine should be pale yellow, and that's how you know you're hydrated. You should also know that people in sub-Saharan Africa are very undernourished and they still breastfeed their babies. So your protein and nutrient content of the breast milk will not change. However, you might just feel terrible that day if you're not getting enough calories. But hydration is really, really important. And you said something interesting about not knowing if your baby was getting enough when you directly breastfed. So you got comfort in pumping. You know, I would say that's why I work with my patients for the first 8 to 12 weeks, because that's one of the number one things we overcome. Because if you get 3 or 4 weighted feeds, like you're able to like feed the baby or weigh the baby before they eat, and then our scale is accurate to 2 grams or 2 milliliters, and then weigh the baby after, and you're like, whoa, my baby just took 4 ounces in 15 minutes, and she's done that for 4 visits every time you come, Naomi, then you can have more comfort in knowing that she's getting enough. Or if I can teach you when to finish nursing on one breast and go to the second, because a lot of people don't know, should I feed on one breast only or both, and is it 15 minutes and 15 minutes? And if we can teach you that, then you get a nice full milk drunk baby for a good 2.5 hours. Then you don't feel like you need to have like a backup plan like a pump. But every person just can do is your baby, is your boobs, and you're the boss, so you get to make that call.
Do you have a recommendation on one boob versus the other boob? Like some people have said breastfeed all one boob and drain it, and then the next time do the other boob, or switch them at every 10, 15 minutes. Do you have a thought?
Oh my gosh, that's so complicated. It depends on how old your baby is. It depends how much milk you have, and it depends what number baby it is. Okay. Because you have so much milk usually in your second and third baby. So for people who have an oversupply, and you just hear, this is what an oversupply sounds like. You bring your baby to the breast and they're like, gulp, 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 and they come off and they get sprayed in the face and then they come back on, gulp, gulp, and it's like a hot mess of a feeding, right? And so that's just like, wow, it's a lot of stress.
It's never been me.
But that is just because you, like the advice is, like I said, for each person, I would give different advice. If that is you, then yes, you're a one boober, and let's feed that baby on one breast for that feeding and drain it, and then your baby should look nice and satisfied after they eat. If it's 15 minutes after they've eaten and they're fussing again, you can feel your own breast. You can squirt milk out. You'll know if there's milk there. You're listening for swallow sounds every time you attach your baby, and that's how you know they're getting milk. Now, if this is your first baby and your baby's falling asleep at the breast after 5 minutes, you need to then wake, change diaper, and put them on the other breast. And if she falls asleep again on 5 minutes, wake, change, put on a cold, hard surface, do some tummy time, and then put them back. We call that switch nursing. and we have to figure out why they keep falling asleep. Usually when babies are falling asleep at the breast after the first 2 weeks of life, it is because there's not enough milk there. The baby has a tongue tie and not able to remove milk effectively, or they are preterm, 37 weeks or something, 36 weeks, and they just don't have the stamina to do that.
To stay awake. And that's after 2 weeks though.
Correct. Because the first 2 weeks they're
tired.
Snacking and tired and just making you second guess your life choices.
Totally. Yeah. And I remember she kept falling asleep and we'd have to blow like cold air on her to keep her awake.
It's hard.
Yes.
Little insider tip is stroking them under their chin right here when they're at the breast can actually help them to start sucking again.
I love it.
But it's still challenging.
Yeah, I mean, totally. Okay, I'm just going to see.
To kind of take it back maybe 10, 15 minutes, you kind of touched on partner dynamics and
yes, that's good.
Obviously the load that that mothers and women carry through pregnancy and through breastfeeding if they choose is unbelievable. And like what you have experienced in the 9 months prior to Tate and now the 10 months since, like you are truly
that's very sweet. Thank you, sweetie.
A hero. And you kind of on the other end, like she's doing truly the heavy lifting. What are the things that you see fathers do well to support, and what are the things that you see fathers do poorly that create issues in relationships when mothers are either breastfeeding or formula feeding?
Yeah. I think one thing that fathers do really well is help temper the mom emotions against reality. So what I mean is I come in, a mom's like, the baby's not feeding, the baby is up all night, and the baby this, and really gassy. And then the dad will be like, well, what I saw was the baby, and they give me good data. Like, okay, baby woke up and had 3 feeds in the last 8 hours, and the baby ate this amount of ounces. And then when it comes to tummy issues, this is what I noticed. And I feel like they can give me objective information and then can kind of be the truth holder, if you will, to help us as a team maybe help reassure the mom that while you feel like things are terrible this week compared to last week, wow, we've made really great accomplishments. I had a patient yesterday who asked me, her baby's doing amazing and she's doing amazing and the baby's only 2 weeks old. They're just like rock star. Everything about them is just amazing. But she's feeling really insecure and she thought her baby wasn't gaining weight because she decided that she wanted to know how much her baby weighed. So she got her husband get on the scale and clocked his weight and then had him hold the baby and get on the scale and try to weigh the baby. And it looked like the baby didn't gain any weight from last week, but the scale is not accurate enough, right? So she was tripping for like the next 3 days until I came and I weighed the baby and the baby gained amazing weight, just perfect, right? And she was like, oh, I'm so relieved. And the dad was trying to cheer her. And he said to me, Naomi, she doesn't listen to me. When I encourage her and tell her she's doing a great job, it doesn't mean enough. Would you mind if I record a video of you telling her she's doing a good job so when I'm not here, she might believe it?
Oh.
And I was like, that's so smart. And I was like, I'll do you one better. I'll make you a Giphy. I was like, I'll do all the silly, stupid stuff just to keep my patients' head out of their own head. You know what I'm saying? And so I thought that was really kind of him and like encouraging. Another thing I think could be really helpful that dads do is waking up, washing all the parts. A lot of people do that, and being a really good listener. Because I think sometimes we might, as dads, want to fix a lot of things or explain away certain things. And sometimes just listening, so she has a sounding board, because being home with a baby is really isolating. Who are you going to talk to all day? And so even if she could just say all the words and get them out of her mouth and know that it's going to not make you feel on edge, that's really, really, really helpful. Some things that are not helpful, sometimes I see this more with engineer type dads, is trying to make breastfeeding into an engineering feat. So for example, this is not helpful. So Naomi, the baby had, 114 milliliters today in a 19-minute feed. Does that mean if the baby feeds for 25 minutes, then the baby should then transfer 146 milliliters? That's not helpful, because that's not how the human body works. And then you're putting way too many brain cells in the wrong bucket. as opposed to listening to the advice that I am going to give you so that you can feed your baby effectively. Because babies are not little machines. Sometimes they want to eat a ton at one feed, and maybe the next feed they don't want a ton. And sometimes they'll spit up a lot during this moment and then not spit up a lot the next moment. So they do not follow like a even and smooth formula. So medicalizing or like engineering infant feeding is not real helpful. And I just have a lot of really great dads and stuff, so I don't have a lot of negative things.
Well, I think the two things that you said that really hit home, number one is making the emotions reality. So we've never talked about this or thought about it, but if it's in the early stages, mom's like, she was up all night, I don't know, but dad says, no, she was up twice, and here's exactly how much she ate, or here's how long she was on the boob. Turning it into reality and him tracking that with a sound mind feels like something that would be super helpful.
Yeah.
And the other thing you said, and it's something that we do, is he told me early on, no matter how tired we are, no matter what's going on, you can always say, will you go get my pump parts? And I will always go get them. So sometimes we'll get home from the airport, 1 a.m., we'll get in bed and I'll be like, oh my God, I have to pump. Will you go get my pump? He always, every time he goes, he gets them and he washes them. And it's something I know I can always ask for. Even in the middle of the night, I can tap him and like he goes and gets my pump parts. And just knowing I have that support.
And with a good attitude.
With a good attitude.
Because if you're doing stuff with a stank attitude, then you're like, I'll just throw the pump at you next time. How about that?
And
like, you don't even want it.
And that would send me into a spiral. But most of the time, like this morning, he sets my pump parts on me. And it's just like, I have to pump no matter what. So to know that I have a partner in that's like doing the most that they can with a smile on, I have found to just be like so helpful. And then
like he initiates. That's the cool part is like the initiation part versus like, because you don't want to ask. You don't want to be helpless. You don't want to be needy. No. That's not what we want. But someone who's just like there, ready. Like I'm the biggest cheerleader. I'm your biggest cheerleader and you don't even have to ask. Like that's irreplaceable.
Totally. I totally agree.
Good job, Harrison.
Yeah, good job. Thank you.
To kind of summarize what you said from like the guy's perspective, right? Because you gave a lot of great kind of bottoms up answers, but like thematically, be engaged, be attentive, listen, and recognize the dynamic that just because you're not the one doing the action doesn't mean there's not other ways to support, and read the room as to what those ways to support are based off what your specific partner and mother is dealing with and looking
desiring,
for.
Yeah. And enthusiasm. And what you're doing, like doing things without complaining and doing them preemptively, goes miles. Like it's just, I can't tell you how much. Versus the dad who's totally checked out. It's the first lactation visit. He's kind of like, that's your department. My department is over here. And then like you need the dad's ears to listen because you're not going to remember everything. And you need someone of sound mind and body to like help out with that.
The education on, like, I think the education on pregnancy and how tolling pregnancy is very well out there. And I think that was on her radar. And I think there's a lot of, that mindset into the guy on, be supportive, lock in,
make the meals,
But I think that the education around how tolling,
making milk is
the making the milk, that has been the shocker of shocker, I think, to both of us.
I don't think we knew how tolling.
I like, just knowing, I think, like I didn't really know going into it, but like now knowing when you go into that first lactation visit, like, hey, like this is going to be a big thing. In the same way that during doctor visit 1, you were locked in as the support, like going into the lactation first meeting, same mindset.
Totally.
There's a lot of amazing. I mean, I gotta say, I'm blessed with like amazing dads. Like it's not that often. I also don't have the demeanor to handle a lot of crazy dads, so they don't.
Which is good.
I'm not having that because you just had a whole human and you have to feed a whole human. So get it together.
Yeah,
so I'm really lucky that a lot of my patients are just amazing.
Well, on a whole separate note, I do think that that what's becoming more popular is engaged dads, and I love that. As I don't want to say a trend, but I like that
That's why when people used to tell me, "Oh, your husband's babysitting," like that my kids were
Babysitting.
Like, babysitting? They're his kids. What do you mean he's not babysitting? He's just doing his job. Like, I'm not babysitting my kids when I'm with them.
No, we don't use the word babysit either. Dad's with her or I'm with her. Yeah, I totally agree. Okay, thank you. Like, you gave us so much good information.
Good. I'm glad.
Thank you so much. And I think that my biggest takeaway is just a happy mom is a happy baby. Mental health is the most important.
Yes.
And it was just a fabulous episode. So thank you so much.
Thank you so much for having me and considering me to be a guest on your show. I appreciate it.
That is so sweet.
Thank you.
Thank you. And thank you guys for listening.
Thanks for listening to another episode of Two Parents in a Podcast, powered by Just Media House. If you enjoyed the show, don't forget to like, subscribe, comment, rate, and review. Stay connected on Instagram, TikTok, YouTube, and Facebook at Two Parents in a Pod. Welcome to our home. Sorry it's so messy. New episodes every Thursday.